we have. But over the years, every year I've held a ward meeting in every ward, a town hall type meeting in every ward. And of course, we've normally done those live. Usually in this case, in Ward 7, we usually go to the Dr. Crisp School. And of course, now we have the COVID pandemic and we have to adjust to that. So we're beginning to do these virtually. This is our first one. So bear with us if there are any technical problems. We also have done coffee with the mayor this way, but this is a little different format. So joining me, in addition to Alderwoman Karen, is Bobby Bagley, who is the Director of Public Health and Community Services, as well as Megan Karen, who is Director of the Arlington Street Community Center. And they're going to each speak with you for a few moments. No one got any of that?
No, you can start over.
I am unmuted.
Okay, go ahead.
Can you hear me now? Should I start all over again?
No, I think you can.
I heard you, Mayor.
You did? All right. We were afraid no one could hear. Okay.
No, we're good.
I heard you. Yeah.
All right.
I
So
heard you. Yeah.
sorry about the technical difficulties. So usually I speak about a few things, just bring up some different issues facing the city. Maybe June has something to add. We're going to hear a little bit from Bobby and Megan, and then we're open this to any questions from people from Ward 7 who are interested in anything that's going on with the city. First of all, I think it's important to update you on the COVID pandemic. Bobby Bagley is leading the city's effort as Director of Public Health. We have, and I have to say that the Public Health Department and the public health nurses have done a great job in trying to contain the virus and protect our Nashua residents as much as we possibly can. So far in Nashua, we've been relatively fortunate. I mean, certainly more than we would ever want, but still, we've had a little over 1,100 cases, people who've tested positive, myself being one of them. We could talk about that if you want. We've had, unfortunately, very unfortunately, we've had 40 people pass away here in Nashua as a result of the coronavirus. 40 families suffered a big loss, a very hard way to go, because often family members cannot visit a very highly stricken coronavirus victim in the hospital because they're still very contagious. So that's been a tragedy. Right now, or earlier in the week, we had about 90 active cases, and we had about 190 contacts. Public health follows up with any positive patient to determine who they've talked to or who they've been in contact with in the period before they before they developed the symptoms and tested positive, in an effort to make sure that those people who might have contracted the virus will quarantine and be careful and all that. One thing that we've definitely done here in Nashua is we passed a mask ordinance saying that in any public place where you encounter other people, stores, restaurants, things like that, that you need to wear a mask, and the businesses should be asking people to do so. So that, because we know that wearing masks, especially if both parties are wearing them, limits the spread of the virus, really protects everyone from possible transmission. Now, we know that this is not easy. Remembering the masks, wearing the mask, the glasses fog up, it's hard to hear someone talking behind the mask. We know that and I find it difficult, no question about it, but this is something we've done together, big group effort. I'm very proud of Nashua's coming together on this. And as a result, we've limited the number of cases to many fewer than there would otherwise have been. But now that the fall is here, now that we're getting into winter, colder weather, there is more of an outbreak now. There have been more cases recently. At a recent church, recently at a local church, we had about 40 cases. There have been some at a couple of restaurants. It's amazing how the virus can slip in, kind of sneak in with any kind of crack in the armor. So we really still caution people to be careful, particularly our senior citizens, because we know that seniors are most vulnerable to the disease. most likely to get a serious case. But even very young people can get a serious case or can have the disease without knowing it and transfer it to older people. So we want to protect everyone. Bobby can tell you a little more about the details on that. We have decided, though, to go ahead with Halloween. We've consulted with the PD, with Bobby, the public health, and the reasons for that are, first, we thought probably this is a Saturday night, this coming Saturday, people are going to go out anyway. And in addition, we thought that the best thing to do was to issue some guidelines as to how people could conduct Halloween in the safest manner possible. First of all, we know that it's an outdoor activity and therefore is safer than if it was indoors. It is and I think Bobby would say, a low risk activity. But what we ask is that there not be huge groups of people traveling around together, that people just go with their family group or with their close friends, small groups, and that the homeowner who decides to participate, and if you don't want to, if you would prefer not to, there's no problem, just keep your light off. Maybe you put candy out on a table or something like that. Kids can come up and take a portion and then leave. Don't have a big bowl. Try to make individual portions so that we don't have a lot of kids reaching into the same bowl of candy and touching a whole lot of things. If we do it that way, we think we can conduct it in the safest manner possible. One thing, we have Megan here. I wanted to mention that we have the community center open now for a couple of years on Arlington Street, where the former fire station is, where the ballet studio was for a whole number of years. Megan can tell you about some of the activities that are going on there because we'd like to get everyone involved. That's been a great outreach effort. Megan and others, volunteer teachers, have been working with kids, tutoring, a lot of other activities. We want to help to support the neighborhood, Crown Hill neighborhood, and families with that community center. I went to a really nice event in Crown Hill today, and that was at the Infant Jesus Parish. As you probably have heard, Infant Jesus, the former school, and unfortunately the Infant Jesus school closed because it offered a very good education in your neighborhood, but the school closed because there wasn't enough enrollment. But over the last year or so, the parish council, the bishop, have made a connection with an organization called Family Promise. Now, Family Promise had previously had its location over in Hudson, but had to leave that location at the presentation of Mary. What Family Promise does, and it's led by a woman named Pam Wellman, a very dedicated, very charismatic individual. What it does is it takes in families, usually a single parent family, a mother or father who is homeless with children. And then over a period of a year, 6 months to a year, helps to rehabilitate, get that family back on their street, get on their feet, make sure that the adult can get the training they need to get a job and get the kids in school and any other support that they need. And then after a period of time living at Family Promise, they move out into an apartment, into the community, and can join the community and move beyond the homeless status. They've been extremely successful. 80% of the people that they've worked with over about 20 years have been successful in emerging from and transcending homelessness. It's just a great institution to have right here in Crown Hill, helping families where they can, of course, walk in the neighborhood, maybe go to the community center, have access to jobs and some of the services and other activities that are offered downtown. So the governor was there, of course I was there, the bishop was there, a lot of others. It was today was kind of the groundbreaking. Work has already begun on the school, and we're very, very happy to have been able to use that historic building that has an important part in many people's lives here in Nashua for something very, very positive. I wanted to mention some issues regarding the budget. not to get too deeply into it, but we in Nashua here are facing several major financial challenges right now. First of all, the cost of healthcare for city employees has been going up rapidly. 2 years in a row, 2 fiscal years, we're on a fiscal year, meaning it's the city's financial year begins on July 1. 2 years in a row, healthcare costs have gone up $3 million. This is a trend in the industry. So we've developed a solution, one that we think will at least reduce the rate of increase and possibly keep the cost stable for a period of time. And what that has to do with is a change in what we call the plan design, basically changing some of the deductibles, especially for inpatient services. We're working with consultants who really know their business. This kind of thing is offered up in Manchester, and what it will do is reduce costs both for the city and for the employee who has to pay in on a weekly basis. Now, in order to make this solution work, there should be no exclusions, no exceptions. It should go into, it could be put into effect, in our opinion, for all of our employees. We've adopted it for some of the people at City Hall. A union in the police department has agreed to it, but we just need the Board of Aldermen to support us in this, because if we make one exception, we may have to make many exceptions. And believe me, we can save you millions of dollars if we can get this instituted throughout the city workforce. Another big downshifting, as they call it, challenge is that the state pension system has decided to raise the city's bill by $4.4 million starting July 1. Now, city employees are in the state pension system. There's no citywide pension system run by the city. There's a small city pension system for some public works employees, but all other employees are in the state pension system. And the way we got there is 50 years ago or so, maybe more, a little bit more. State promised, oh, we'll pay 35% if you enter the pension system. We'll pay 35% of city pension costs. Great. City entered the pension system, as did basically all the cities and towns in New Hampshire. Then a few years back, the state withdrew its support for the pension system, reneged on the promise, and ever since then, the bills have been going up and up and up and up. There's been mismanagement up there, at least in our view here in Nashua. And as a result, the bill is now up to about $30 million a year that we send to the state of New Hampshire. And that bill is increasing this year by $4.4 million. That's 2% on the tax rate, just right there. We're working with the state legislature to try to change that, but a huge financial challenge because it comes right at the wrong time. Another significant financial challenge is COVID, increasing costs, potentially reducing revenue. We don't know how it's all going to play out, but we know it's not going to be good for city finances, and being hit with this $4.4 million right now is the worst possible time. Those are some of the things that I wanted to mention to you. There are many city issues we could talk about, but first, why don't we go to, we'll go to Bobby Bagley. She'll briefly tell you a little bit about what's going on with the coronavirus, the COVID-19 here in Nashua. And then Megan here, Karen, can tell us a little bit about the community center and the activities that are being offered there. And hopefully June, Karen, a longtime friend and a lifelong resident of Crown Hill, used to work for the city as the recreation director. We still miss her, at least as the recreation director. She hopefully maybe will have a few thoughts as well. So as Bobby, are you on, and can you address the public health issues?
Yes, good evening, Mayor, and thank you for inviting me to your town hall. And I am glad to be here to represent the health department and the work that we have been doing with regards to our response to all things COVID, because that's what it seems like it's been for the past 10 months for us in Nashua and New Hampshire, and the country overall. So our health department has been responding to this pandemic by providing disease investigation and contact monitoring of individuals that have been diagnosed as well as exposed to the virus. The mayor, you did a great job with our epidemiology and all the data already. I do have some updates for the state as a whole, and we usually run our data reports, over a 7-day to 14-day period. So just this evening, the numbers that have come off from the state right now, we had 131 new positive cases that tested positive in New Hampshire. Our daily test positive percent rate for New Hampshire is 1.1%. And that includes individuals that tested using the PCR test, as well as those who've tested positive by the antigen test. So right now in our state, there is a little over 1,100 individuals that have been diagnosed currently. We do have a recovery rate that is pretty high. It is in the 80s, which is good for us. We still continue to see individuals who are dealing with mild disease. And so I think because they have mild disease, we have individuals that don't recognize COVID symptoms right away. And so they continue either doing work or other activities. And because of that, they expose other individuals in their community and, in their workplaces. About 52% of the adults that have been diagnosed with COVID in our state are female, and 48% have been male. And for us this evening, Nashua, we have had 6 new positive cases. So the mayor did talk about what our numbers look like a little early on. We've been running at a percent positivity rate of about 2.2. So that's a little bit higher than what the state's average is, or percent is right now. And we currently are sitting in a place where we've been identified as having substantial positive cases in the state. And now we've been joined by Merrimack County, Hillsborough County, Merrimack County, and Rockingham County are now at substantial case positivity. So what does that mean? What that means for us is that we're starting to see an increase in the number of cases, which we actually expected. So this fall, as it has been predicted around the country, there's been spikes across the whole entire United States, and New Hampshire is no different. What we are seeing is because of these increase in cases, we're also seeing an increase in the number of individuals that are contacts to those cases. Where we used to see 1 to 2 contacts per case, now we're seeing up to 3 or more contacts per case. So now what does that mean for us as far as the work that we do? So we try to move very expeditiously and very quickly when cases have been diagnosed, so that we can connect with people, let them know that their results have come back positive, and then get those individuals into isolation and their contacts into quarantine. The faster we can do this, the faster we can mitigate and slow down the spread of this infection. Over the summer, we did a really good job of flattening our curve, but we knew that when the fall came along, with the change in the seasons, entering into flu season, we had an expectation that our numbers would go up. Now, what that also means for us is that we also have the opportunity to work together to help keep these numbers down. So it's flu season, we know that. It's cold season, we know that. We also know that there are some things that we all can do working together to keep these numbers at bay. And these are the things that, yes, we are all getting very, very tired of it. The mayor talked about, wearing of these masks. And I know that you all probably are like, we don't want to hear about the masks, but we have to, because the masks are one of our cheapest ways of helping us to prevent the spread of this infection in our communities. And so if we can get, and the number at first used to be, if we can get 60% of individuals wearing masks, we can decrease the numbers down. Now we're trying to get that number up to 85%. And the reason why is because our most vulnerable people in our populations are the ones that end up the sickest, have the worst outcomes, And that's where also we see the highest number of our deaths. And so if we can all work together, wear our masks, prevent infection in individuals, even if they're having mild disease, we can prevent infection in those who are not going to have mild disease, and that end up in the hospital. So even with the numbers that we got today, there were no new hospitalizations that were reported today in our state. However, we do have 30 individuals overall that are in the hospital right now. We also had 4 new deaths, unfortunately, in our state as well. And these were residents of Hillsborough County who were 60 years of age and older. And that's the population group that we're really trying to prevent spread of infection in. We also want to prevent infection in our younger population as well, kids, teens, and young adults. And the reason why is because we don't know at this time the long-term impacts of having this infection. And so even though people might have mild disease, they may just have a runny nose, they may just have a cough, they may just have some achiness, the long-term impact or the chronic health conditions that can result from this disease, we're still learning about it. And so the idea for us at Public Health is just to prevent infection overall. So wearing those masks, yes, let's do it. Let's put that challenge out for everybody to wear the mask every single day, over this next couple of months, because we got to get through this season, folks. We have got to get through this season. The social distancing is really important. So what does that mean? It means keeping your distance at least a minimum of 6 feet from individuals that are not a part of your, we want to call them your bubble, people that you hang out with regularly, your family, close friends, that may not have picked up the virus. That's your bubble. Let's protect our bubbles, right? So 6 feet away from those individuals that are not a part of our normal bubble is what we want to have. One of the things that's really, really key is if you have symptoms, and again, remember I said these symptoms can be mild. If you have symptoms, we want people to rule out that it could be COVID. And if they are COVID related, cough, fever, shortness of breath, the muscle ache, diarrhea goes along in there as well, then please, we're asking people to stay home, get tested to rule out COVID, again, so that we can slow and stop the spread of this illness. The other thing that we're asking, and yes, we do sound like a broken record because we say the same thing every single time we get the opportunity to, is to wipe down surfaces and common areas so that we can wipe the virus off of those surfaces. Now, there are other things that we can do. We want folks to be aware of the low risk activities, and the mayor mentioned with the weekend coming up and the Halloween activities. The CDC has said that those activities can be low risk if people do the 4 things that I just asked us to do: mask, social distancing, washing of our hands, hand sanitizing, and then wiping down surfaces. Because even with Halloween and some of those activities, commonly touched objects, we want to make sure that those things are wiped down as well. We want people to think and be creative, have fun, but have fun in a way that's safe, right? If you're going to wear masks, decorate your cloth mask, maybe to match whatever costume that you're wearing. And then I've seen some really nice ones. People coming through our testing clinic have really broken out with some really fancy cloth masks that are like really spooky and scary. So you can have some fun with this. Do things different as far as the distributing of candy. I actually saw on the news, this guy had created a little chute and he shot the candy down through like these little tubes, and it kind of like spilt out down around 10 feet away from him. That's the social distancing piece that we're talking about, right? So do things, be creative, have fun, but we want people to have fun safely. We want people to still be able to go out and enjoy themselves at restaurants, but we want them to do that safely as well. Again, with the mask and the social distancing. And if you're sick, don't go out at all. Now, there are some other things that we're doing in public health. And yes, Mayor, I see my time is running out, huh? Let me give me 3 more minutes. So there are some other things that we're doing at public health as well. We're still working on lead poisoning prevention. We're still doing our immunizations. In fact, we have flu clinics on Tuesdays over at Elm Street Middle School from 3 to 5. You meet our public health nurses over there and get your flu shot, because we are encouraging flu vaccine to help prevent any other respiratory illnesses or during this season. We're also continuing to work on our HIV and STD testing in the community as well. And so we continue doing our other public health activities to meet the mission and the vision of our health department to make sure that we can have a safe and healthy community. So I don't know, I'm going to cut it off there because I know Megan also has some information that she wants to share. And I can talk all day about public health, Mayor. You know that, right?
Well, thank you, Bobby. And if people have questions for you, we'll come back to that. So is Megan on now?
Hello.
Karen. No relation to June, Karen. But,
yeah, no relation. Just the same word.
So could you tell us briefly about some of the things that you're doing at the community center?
Sure. Yeah. So just quickly, I thank you so much for having me. It's a pleasure to be here. Obviously, COVID has thrown a wrench into everyone's plans. So we had to adapt pretty quickly, but what we've been able to do is offer some virtual programming and also offer some to-go activities. So beginning in early July, we started to do both of those, offer both of those options. Since then, we've handed out over 250 activity kits, ranging anywhere from STEM activities, arts and crafts, all that types of things. And we've offered several virtual classes as well, like yoga. We still offer ballet. We had like a pre-K intro to dance camp, lots of different things. The two biggest upcoming classes and workshops that we are offering are an entrepreneurship class for adults, which is 3 sessions. And we're also bringing back our pre-K program. However, it will be virtual. Kids can come and get their monthly activity kit, and then they go and log on and watch the video that the Revere Education Club has recorded of them doing that activity. So the child can work at their pace and at their leisure. So we've had to, make some adjustments, but I think considering, we've been doing pretty well. So we're always open to ideas and suggestions and love to hear from the community. And we look forward to seeing folks back in the center whenever it's safe to do so.
Thank you, Megan. Well, we also have Tim Cummings, who's the Economic Development Director, who can tell you a little bit about the efforts we're making downtown to support our small business community that has been really impacted, hurt by the coronavirus and the closings. Expanded dining, we have a loan fund. So Tim might mention that in case you have any thoughts or questions about that.
Good evening. Thank you, Mayor. So just very briefly, relative to some of the efforts that are going on to help some of the small businesses from an economic standpoint here in Nashua. And most of it is downtown related, as small service-based businesses and industries were affected disproportionately as opposed to larger businesses due to the COVID pandemic. We have, as the mayor mentioned, a loan fund available for parties that may be under distress. This could be used for working capital. It can be used for a litany of reasons, help support bringing COVID-19 type protections, as well as to try to keep people on the payroll. This is a loan that you can get, low interest loan. If you have an interest in this program, you can contact me and I can help facilitate the paperwork for that. We've been doing this for we did one round in May, and we'll be looking to do another round in the fall. In addition to that, we put some barriers out on Main Street to allow for outdoor dining. That's something that was very successful and helped a lot of the restaurants. We're going to be looking to continue that into the winter season. Our traditional outdoor dining season ends November 15th. However, we're in the early stages right now of looking to continue the outdoor dining citywide, particularly in the downtown, due to the various due to the pandemic's issues that are still ongoing. We want to make sure that we provide that outdoor opportunity for folks, because that is the safest way to patron a restaurant or food establishment. Some of the things that are going on in Ward 7, I just want to quickly highlight that may be of interest to folks. The Renaissance Downtown project, I know that is been an ongoing project in the city. There was apartments built. First phase has been completed. There is a second phase coming up. This would be over by the Mansfield site. This would be at approximately 152 apartments. That's going to be filed at the site plan. That will be filed with the planning board. A site plan approval process is still necessary, and that is going to be happening sometime over the next 6 months or so. Right beside that project, there's been an ongoing, what we refer to as an LPA project. That's a state-funded project that's managed locally for transportation improvement that has been often thought of as a rotary that would be occurring right on the Hudson line there. With me describing it as a rotary isn't 100% accurate, because it is a little bit more like a Ghostbuster type symbol. That's probably a better way or more accurate way to describe it. It is not a traditional rotary as one might think. Relative to rail, that is an active conversation that's happening in Concord right now. I can tell you that an RFP was issued and at the state level to procure engineering services to finalize the financial impact phase of the project, and we're closely monitoring that. We have a rail committee here at the local level that's actively monitoring and working with the state. The mayor may have mentioned this and I missed it, but there is the expansion of the Heritage Trail east that is occurring. And that's something that folks should be aware of. That would be an expansion of the multimodal path that would be happening from Main Street on down to the future rail station. I would be remiss not to mention that there's a master planning activity going on over the next year or so, which I would encourage the neighborhood to get involved with. I believe the Ward 7 neighborhood, particularly along the Hudson line, is a neighborhood character that will be changing due to market changes that are beyond a lot of people's control. And I think it would be really important for folks to get involved in the master planning effort. This is being run by Director Sarah Marchant. I'm sure she can provide more details, but it is something that I think would be beneficial for everyone to be aware of. And that brings me to large land sales. So along the Merrimack River, in Ward 7, I would be remiss not to mention that there are a couple large pieces of property for sale right now down by Burke Street and Crown Street, where those are more heavy industrial type uses. And I can tell you that the activity mostly is interested in multifamily type housing. I don't know what the market will actually do, but I can only envision it would be something very similar to what happened at Henry Hangar. And we know that the Henry Hangar building was permitted for apartments, and I could only suspect something similar like that will happen. Relative to Henry Hangar, I know that that development has been stalled a little bit. I spoke to the developer actually a little while back now in the summertime, and he is trying to move that project along. So that's a quick update that I wanted to give everyone on the differing economic activity that's occurring in Ward 7. Thank you, Mayor.
Thank you, Tim. Now, June, as I mentioned, has been, of course, a lifelong resident of Crown Hill. I haven't told her this, but I was mayor a long time ago. She was recreation director, and I have a picture up in the attic of the two of us at some ceremony, which I've been meaning to bring, but we always meet virtually, so I could never actually see her in person. But this November coming up, we have the annual Nashua Senior Lunch. Now, this would have been the 50th year, and the city has offered basically a Thanksgiving lunch to seniors who sign up. It's a very popular event. June has gone all but one of, so we've held 49 up to now. June has gone to all 48 of the 49. So we named it the June Karen Lunch. Now this year, we're still holding it, but we're not going to get together in a big group. It's going to be, we're going to hand out meals that we think are going to be pretty good. I think we'll do it outdoors. You know, you drive up in your car, and that will probably take place around Stella Stadium. But there'll be more on that soon. But that is the June Karen Senior Lunch, which unfortunately in its 50th year will have to be in a different format. But June, do you have anything you'd like to mention to our Ward 7 residents?
Sure. Thank you, Mayor. And first of all, the state pension started in 1975 because I had been working for the city 10 years when Nashua became part of the state's pension program. So it's been a long time under that control, and they've had a lot of changes. And I know what the struggles are for the cities and towns to participate in that. So we really have to work with our state reps to make some changes and get the state back on board. The other thing is, thank you, Megan, Karen. My husband always says all Karens are related somehow, but you have been doing a fabulous job over there at the Arlington Street School site. And I hear great things about it. And I'm hoping that when things get better, you will come up with some new and innovative things for our community and Ward 7 to do. As far as I'm hoping that our seniors are going to vote next Tuesday. It's important. I want them to know that the city clerk's office and all the volunteers who work within the 9 wards will make it safe and easy for you to go. But if you haven't and you don't feel comfortable going, hopefully you have filled out that absentee ballot and taken part in your right to vote. Director Cummings, as far as the master plan, I had spoken to Sarah Marchand, and she is working with our senior center to do something so that our seniors can take part in discussions concerning what's happening, especially in Ward 7, because there are a lot of changes within our little community. So we certainly want to hear their voices and know that their voices are heard and their concerns are heard moving forward. I think it's great. Mayor, I think the city has done a good job trying to keep this virus under control. I commend Bobby Bagley and her group for doing that. And also, I know the people in Ward 7, they're wearing their masks, they're social distancing. I know how hard it is, but we appreciate it because we want to come out of this, hopefully in the spring, better for it. And I think that's great. And thank you, Mayor, for reminding me that I spent 50 years working on a senior outing, and I am really sad that we're not going to be able to celebrate the way we thought we would. But I have talked to Kelly and some of the things that they've come up with. I certainly will make sure that I will be there so I don't miss the biggest one, but hopefully next year we can celebrate 50+1 moving forward. And I also want to thank you for doing this town meeting. I know how difficult it's been to try to set it up because you have been doing this for the last 4 or 5 years. And I think it's great that you've tried to put this together. And thank you.
All right, well, hopefully, June, you can come by and help hand out the meals on the 50th June Karen Senior Lunch.
Yes, I'm hoping to be there.
Now, we did get a question by email having to do with the flagpole out in front of City Hall. So the flagpole is used for 4 different purposes. Number one, flags sometime, well, there's the American flagpole. That's not this one. It's the one, and there's the state flagpole, but this is the 3rd flagpole. 4 reasons. Number one, flags that support cultural heritage. For example, we during Greek Independence Day that week, we put up the Greek flag. We put up the Dominican flag during Dominican celebrations. We have put up other nations' flags to celebrate various, the French flag we put up during the Francophile week. And so that's one purpose. A second purpose is to observe an anniversary of some kind, an important anniversary. Number 3, sometimes it can be used to honor a special accomplishment by the city or one of our residents. And number 4, in support of a city sponsored event. And we took down a flag that was put up with a permit, but we didn't really realize what the flag was. It was the permitting went through the risk department, and it was a Defend Women's Sports flag, but with some fine print. And apparently, we learned that that is an organization that advocates regarding women's sports. And when you look, it advocates that transgender sport athletes basically be discriminated against. And state law in New Hampshire prohibits that type of discrimination, state policy and state law. So it really advocates something that violates state law. And in addition, the city doesn't support discrimination against anyone. We're trying to be a welcoming city, and therefore, we want everyone to be welcome and valued, but particularly because state law in this case makes that type of discrimination illegal. We certainly don't want to support an organization that may be advocating that. So, and in addition to that, it doesn't fit any of the categories that I gave you. It's not an anniversary, it's not heritage. So for that reason, we took the flag down. Are there any other questions from any of our Ward 7 residents, comments, questions about anything that any of us that have spoken so far could answer? And I've got Cheryl here across the room. We're definitely socially distant. She's like 20 feet away, and she has a mask on, and I would have the mask on, but I'm trying to talk to you.
We had the same question about the flag.
We had a question about the flag. Okay.
Other than that, I'm not seeing anything.
All right. Well, we're not seeing any other questions or comments. Now, it's much better to do this in the Dr. Crisp library where we
I just
normally.
unmuted you. You could say, I have a question.
There's a lot more interaction.
Just say, I have a question.
Okay.
Hello?
A question. Go ahead. And could you please introduce yourself just so people know who you are?
Hi there, this is Stephen Scare. My question was specifically, you called the flag transphobic in a Union Leader article, if they quoted you correctly. So that's fear of, I don't know, people with gender identity disorders. But what is this flag transphobic? Is that the word that you meant?
I don't think I used the word transphobic. I didn't see the article, but I don't really know what that word means, and I can't believe that I really used it. I did articulate, I'm sure what I already said was that research suggests that the organization does advocate, I know a discrimination or a different treatment of transgender athletes, which as I've said, violates state law and state policy.
Hi, this is Beth Scare. The flag was for saving women's sports, and it was advocating for what Title IX is supposed to provide, which is that women have their own sports.
Well, there's
and there's nothing discriminatory about that. Men have their men's sports and women have women's sports. Every reasonable person understands what that means. It doesn't violate any state law. And it was celebrating Selena Sewell's run which was going to start that Saturday. So it does fit into the category as described for the citizen flagpole. And I'm very disappointed that you are making up excuses after the fact. After we already raised our flag, now you're looking for excuses. And my lawyer filed an appeal. You had 10 days to respond, and you didn't respond.
Well, Beth, actually, there's a case out of Boston decided last year by the First Circuit, the federal court for this area, deciding that a city can control its flagpole and doesn't have to open it to any cause. Now we could debate.
Well, then why wasn't that addressed to the attorney within the 10 days of the process?
Well, this was, I guess, 10 days that he created. I don't know.
No, it was written right into the ordinance for the events procedure.
Well, the legal department is responding, but
Okay.
there is an organization that connects with this cause, so-called Save Women's Sports. There's a website, and they make very clear what they're advocating. And at least
Yeah,
in
they're advocating. Yeah.
our view, it advocates discrimination. It does not fit any of the categories for the city flag, and therefore we took it down.
Well, your view, that's what this is about. Your view. And you're the mayor. I'm the public. Your view doesn't overrule the public's, my right as a member of the public. And I'm looking forward to the letter from Nashua Legal Department. Thank you very much. Bye-bye.
Okay, thank you. Anybody else have questions or comments? Again, I just reiterate that the causes, the reasons for the flag are either support cultural heritage, observe an anniversary, honor a special accomplishment. This really means by a Nashua resident, not by necessarily someone else, and in support of an event that the city has sponsored. And we will continue to apply that policy. So any other questions that anybody has? Any other questions or comments? All right, well, for those of you who did join us or those who watch this by recording later, thank you to our guests, to Bobby Bagley, Public Health, to Megan Karen at the Community Center, to Tim Cummings, updating you on much that's going on in the city. And of course, Alderwoman June Karen, thank you for joining us. And we will be holding ward meetings in all of the wards virtually, and hopefully as we go along, we can just perfect this technique. Thank you for joining us.
Thank you, Mayor.